So let's get started on Medical Monday. So Medical Monday. So we always look at medical, some kind of medical information that we can share with you on a Monday. And in Prevention Magazine, there was an article titled, "Here's the Exact Way to Organize All Your Health-Related Paperwork," written by Mary Grace Taylor. And she discusses the importance of staying on top of medical records, bills, insurance statements, and exactly how to do that. We know that our healthcare system is very fragmented, and managing the endless paperwork surrounding it can be and will be overwhelming. So there's a great article about how to track everything and which things to throw out. And basically what it says is, and I'm going to go back up to the top here, basically what it says is that you want to keep your insurance statements for at least 3 years and your bills for at least 3 years. I would say that I do that. I keep all of my paid bills for about 3 years, and they're all organized. It took me a long time to do that. But the things that you want to keep indefinitely would be any kind of doctor's visits, any kind of summary notes that you would receive, reports from any of your scans, any tests that you have, your pharmacy printout of your current medications, any hospital discharge summaries that you have that you can refer back to them. And all of this information, you have to decide whether you want to keep it digitally or you want to keep it on paper. Most of mine is saved in my patient portal. So I don't, like when I leave my doctor's office and they give me the summary, my summary always includes a list of my current medications. If anything has changed, I rip that off and put it on my refrigerator. And sometimes if nothing has changed, I rip it off and cut it out and put it in my purse so that I can have it at my appointments when they ask me about all the medications. I always make sure I go in and read my doctor's notes, because sometimes what they said to me is different than what they wrote in their notes, or they misinterpret something that I said to them. And I will send them a quick little message and either asking for clarification about something that was said and then different in the notes, or that I understood differently, or information that I gave them that they did not put into the notes correctly. All my scans and reports are always in my patient portal, but you definitely want to keep those. And then those hospital discharges, they're all of mine are also digital, so I keep them all on there. But my best advice, and what they said in the article also, was to just do one huge, big organization and then keep up with it. And I remember mine started out on my dining room table. It was extremely overwhelming to me. I go to University of Maryland, the medical system with University of Maryland, and I had all these bills from University of Maryland, and they didn't make sense till I understood that absolutely everything had a separate number, like ID on it. So like any kind of pharmacy I had a separate bill. Any kind of I don't know, CT scan had a separate bill. So I made a folder for each one of those account numbers, and I keep that all separate now. I also found, and you may find this too, is very often my copay is $10. I'll pay my $10 and then I'll get a $10 bill in the mail. So then I have to make a copy of my receipt and send it in, and usually that solves the issue. But I don't know why they try to bill you when you've already paid your $10. I don't know how it gets lost. I don't know if somebody explained to me one time that when you come in, that bill, it gets automatically sent to you when you arrive, and they don't know that you've paid it. So there's some kind of glitch there that makes me crazy. And it is really hard to keep up with it. I actually had my sister help me. I'm like 4 years in for dissection and 5 years in for breast cancer. And it was crazy. So my sister, she helped me with that one big organization. We went and bought all kinds of manila folders, and we labeled everything. And I bought a plastic bin, And the only thing in that bin are my medical, anything medical. Like I printed out when I had some genetic testing, I did print that out because I'm so scared for some things that I would lose, that's digital. So anything that you think is really, really important and you don't want to lose it, and you don't trust the medical digital system, go ahead and print it out and put it on there. So that's all my advice for your medical records. I know it can be overwhelming, and ask for help. Make phone calls. There's more than once I've haven't paid a bill that I was sure was paid, and then to find out I hadn't paid it. It can become very, very confusing. So best of luck to you. We're all in this together. We're always here if you want some advice. I do know that in that article, I think there were 3 different links that they provided that could help you with your with the organization of your medical records. So there you are.